Bismillah ar-Rahman ar-Rahim. Now we will start with our second part of the lecture. In the first part, we were talking about edema or accumulation of fluid in the interstitial spaces, and we said edema is related to fluid accumulation and blood movement. Now we will talk about hyperemia and congestion. This is related to blood movement. So what's hyperemia and what's congestion? Hyperemia is accumulation of fluid or increased blood volume in an oxygenated blood volume in vascular spaces. So hyperemia, you have two types, active or negative or passive hyperemia. Before we talk about active or passive hyperemia, we will give an example for hyperemia. If you are, for example, exercising or jumping, you will feel what? Your face will become flushed and you will feel hot. Why you feel hot and flushed? Because there is more blood coming to your face. This is hyperemia. Okay. In inflammation, if you remember, we said the signs of inflammation are redness, hotness, loss of function, hyperemia. Why hyperemia or redness in inflammation? Why? Because more blood is coming to the inflamed side because of vasodilatation. So this is hyperemia. Hyperemia could be physiologic or pathologic. Now, if you have accumulation of oxygenated blood, this is active hyperemia, like what? Jumping, exercising, running. So this is accumulation of oxygenated blood within the vascular spaces, not outside the vascular spaces. Outside the vascular spaces or blood oozing outside the vascular spaces, this is bleeding, nazif. So bleeding, blood oozing outside the vascular spaces. But hyperemia, accumulation of a blood where within the vascular spaces. So active hyperemia, if you have accumulation of the blood. Passive hyperemia or congestion, if you have accumulation of deoxygenated blood. How? For example, if you wrap a band around your finger, okay, you will close the venous return. Your finger will turn blue in color, يزرق في لونه, okay, and will become swollen. Why your finger will become blue in color? Because of accumulation of deoxygenated blood. Why? Because you occlude the venous return. Blood does not go back to the heart. لا يعود. Okay. Why it became swollen? Because when you wrap a band around your finger, this will increase hydrostatic pressure. If you remember from the first lecture, increase hydrostatic pressure, this will to swelling. So hyperemia, you have two types: active accumulation of oxygenated blood or passive accumulation of deoxygenated blood. Usually active could be physiologic again or pathologic. Physiologic like you are running, jumping, or you are exercising. Pathologic like in inflammation. Hyperemia, usually almost always it's pathologic and you have impairment of venous return. Okay, so active hyperemia, increase in oxygenated blood. Passive hyperemia or congestion, if you have decreased outflow, obstruction of the venous outflow, you will have accumulation of deoxygenated blood. So the organ became blue. However, in hyperemia, active hyperemia, the organ became what? In color. What are causes for venous congestion or obstruction? The obstruction could be from outside. If you wrap a band around the venous or the vein. It could be from inside if you have a thrombus, khafra, or jalta within the vein. Okay, so it could be from or inside. Of course, congestion could be systemic or could be localized. Systemic, like if you have, for example, congestion in the liver tissue, احتقان في القلب, in the kidney, in the spleen, in the lung, regardless the cause, you have obstruction for the circulation. Okay, or it could be what? It could be, for example, this is a microscopic image taken from the liver parenchyma. These are hepatocytes. الخلية المكونة للكبد, hepatocyte. Between hepatocytes you have sinusoids. Sinusoids are where the blood circulates. Okay, in congestion you have accumulation of too much blood where in the sinusoids. So these sinusoids became dilated. This liver. Okay. In the pulmonary circulation, this is an alveolus, حويصلة هوائية. Within the alveolus you should have what? Just air bubbles. you shouldn't have anything other than air what bubbles. Now you have what here? You have hemosiderin-laden macrophages. These are macrophages engulfing red blood cells. You have debris, you have inflammatory cell lymphocytes, you have red blood cells. Why? Because instead of having air bubbles, now you are having blood and it's component in the circulation in the alveolar spaces. This is what? This is pulmonary. Okay. Now we said pulmonary congestion or hyperemia, regardless it is active or passive, is accumulation of blood within the circulation. الدماء ما زالت داخل الأوعية الدموية. However, if you have a break or injury to the blood vessel and the blood came outside the blood vessel, this is hemorrhage or bleeding, نزيف. And the process that the body starts or initiates to decrease or to stop a blood loss from the site of injury and forming a clot, we call it hemostasis. So hemostasis, heme stands for blood and stasis is balance. Hemorrhage stands for blood and hemorrhage is leakage of blood. So hemostasis is a physiological process that the body initiates to stop a blood loss at the site of injury. How? By forming a clot. خثرة, a clot. You have a clot, you have a thrombus. A clot, خثرة, a thrombus, جلطة. A clot could be physiologic or pathologic. If you have a clot at the site of injury, let's suppose this is a blood vessel and this is injury in the blood vessel. If you have a clot at the site of injury, so this is physiologic, we call it what? Clots. But if this clot is formed within the blood vessel and occluded the circulation, we call it what? We call it a thrombus, جلطة. Okay, so thrombus is what? Is pathologic. A clot could be physiologic or